Hi.
They're way off.
I'd like to call the January Operations Committee to order, please. I ask for a motion to approve the agenda. Bill Sheridan, second. Dave Forsythe. Is there any questions? Can I have everybody in favor and anybody opposed to it? No? Okay. Sorry, guys, you'll have to bear with me here. I ask for a motion to approve the December 14th minutes.
So moved.
And they have a second? Jim Reagan is the second. Larry Denisha was the first on that. Is there any discussion? All those in favor?
Aye.
Any opposed? Okay, motion carried. We have a COVID-19 update from Dr. Dana McGuire and Dr. Andrews. I think that Dr. McGuire is going to go first. Do you see Dr. McGuire? Yeah, she's seen later.
Can you hear me okay?
Yes.
Yes. I can't see. There you are.
She's on mute.
You're on mute.
Can you hear me now?
Yes.
All right. Thank you. I tried to get a new microphone, so hopefully you can hear me better this evening. So I apologize for that. I'm going to share my screen for the slides. Okay. So I'll just give an update where we are with cases and go into vaccine, and then Dr. Williams will also just follow what I say as well. So as of this morning, we had 3282 for cases to date, and that's since March 25th. We currently have 24 people in the hospital with 878 people currently in isolation, and 2331 have been through the process. To date, we have had 49 deaths. And as a note, on November 1st, we had 4 deaths. So most of the deaths we have seen have happened in the last 2 months. And we have had 597 cases since I reported to you last Monday. Here is that daily curve that I show. It just kind of shows the ups and downs that we see, but you can see the spikes that we're seeing since the holidays. We are getting so many dates now on the graph that the dates don't show up as often, so it is hard to pinpoint days. But in the last 2 weeks, the numbers we see on a daily basis have been rising. Here, we do reporting from Wednesday through Tuesday, so the numbers here are from yesterday. So you can see that, we continue to rise. We have seen 534 cases, which is a little bit different than what you see here. It was only 460 here, but I have included those numbers from this date, which is 70 more cases. And so on an average, because I did the average with 5 days in the week, you can see that we are still increasing, so we have not reached a plateau yet. We continue to see more cases. So this week, with that 5 days in the reporting week so far, we did see 92 cases, where in the previous week we saw 83, and then the previous 2 weeks before that, we saw about 47 cases per day. For those who have been through the isolation and the quarantine process, We currently have 902 people, and this was from this morning. This number changes throughout the day, but 902 people who are either in the isolation process or who have been hospitalized, and 819 people who are in active mandatory quarantine. You can see here that we're not reporting the precautionary quarantine. That was quarantine for those who have been through the travel process. So it's hard to know whether people are not reporting their travel as often, or if people are doing the test out option, because that test out option goes through the state instead of going through our department. And there have been over 13,000 people who have either been through isolation or quarantine. So now kind of flipping the page to us planning for the vaccine and how we're going to get out to all of the communities here in St. Lawrence County, we have been working actively with the North Country Hub, of which CVPH Hospital is the lead for that hub. So there are the 7 counties that meet and discuss, usually twice a week, where CVPH does have a lot of meetings with the state and then passes down all of the information of what we as public health departments need to do with the hospital systems and the providers. So we are working very hard here in St. Lawrence County to create the community pods, which are the points of the distribution, so that we can have access for all who would like to be vaccinated. We have divided the county into 4 regions, so we can have 5 sites in those regions. So we're looking at the Potsdam, Ogdensburg, the Messina, the Governor, and the Star Lake areas. We have started working on the MOU agreements, and the first agreement we have signed is with SUNY Potsdam. So the county does have a signed agreement with them to start as a community pod site. We have been meeting regularly with St. Lawrence Health Systems to work jointly to provide vaccination to the community. And so we are currently working to see how that can happen. The Public Health Department has more access to the administration piece of it, so that after you get vaccinated, it flows into the state system, and they can provide the resources that we need for vaccination and for the observance period that is required after the vaccine. So those meetings take place almost on a daily basis. We are still doing site visits in all of the other regions to make sure we can get just an MOU in place with those sites, and we should have that done by the end of the week. As for the priority groups, as you know, we started with 1B today, but 1A is not yet just complete, and so I just wanted to go through who is involved in that group. So it remains to be worked on, and the 1A group is going to be focused most by the hospitals as we move into 1B, but it's all of the high-risk healthcare workers, whether it's at a hospital, a nursing home, a health center. It's for EMS workers, all the funeral workers and coroners, all those who work with the disabilities, mental health, and substance use disorders, urgent cares, those who work with COVID-19 testing and vaccination sites. So all frontline workers that have to do with patients, whether it's medical or administration. So that is really what phase 1A is. And as today we move into phase 1B, those general categories are those who are 75 and older, teachers, first responders, public safety workers, and the public transit workers. To break down those groups a little bit more, we did receive notification this afternoon on how to look at those groups. So this information is just changing very fast, and we're learning more. So we don't even have quite all of the information about 1B yet. So those who are 75 years and older, that's mainly going to be taken care of by the pharmacies in the area. And then all of the essential workers will be the public health department with the help of the hospitals. So you can see those groups start here for first responders, which includes fire, the police, public safety, and sworn-in personnel. It's the corrections. It's the K-12 schools that includes all school staff and daycares or childcare facilities. It also includes in-person college faculty and instructors, childcare settings like I mentioned before, the public transit, which would include bus drivers, the public-facing store workers for groceries, and then individuals who live or work in a homeless shelter. So those are all of the groups. What we're trying to figure out right now is we as the public health department are still waiting to receive our first shipment of vaccine, and we are working with hospitals to see what they know of what their new shipments are going to be. So with the opening of 1B and the helpline that the New York State Department of Health has that was supposed to open at 4 p.m., we are receiving a lot of calls for how to go about this. So there has been a lag of the supply of vaccine to the opening of the groups. So we're still waiting to gain more information from the Department of Health on that. And we actually have a call this evening to learn more about the 1B group so that we have more information on how to do the direction of the community. With all of this and the vaccine forthcoming, it is still really important to follow guidelines that we've been talking about for so long. So making sure to wear a mask, do social distancing, hand hygiene, and being aware of how you feel. We've been getting a lot of questions on whether after you're vaccinated, whether you'll have to participate in quarantine if you've been exposed. And at this time, we don't have any change in the process. We're not sure how long the immunity lasts with vaccination and all of its response. So at this time, we're still going to be practicing, which is what the state has recommended to do, that you would go through quarantine even if you had vaccination. So that is what I have at this time, and I will stop sharing my screen so that Dr. Williams can also share his information. Thanks very much.
So good evening. I wanted to start as usual, just kind of going over a quick national summary. So if you look at how we're doing on a national level, we've got more than 22 million cases. On one day alone, we've had up to 250,000 cases, which is about a 34% increase from the previous 14 days. As for deaths, we have more than 370,000. And many days are over 3,000. One day was nearly 4,000. For hospitalizations, nationally, it's about 130,000. If you look at our region, again, we have this steep upward climb. Looking at daily new cases per 100,000, we're at 73. I believe if you look at the county, we're somewhere in the 80s on that same measure. For percent positive tests, we're at 8.2, which for the past several days has decreased just slightly, and we would hope that that would be a continuing trend. I did want to give a brief update on something I talked about in the past, which is for people who develop COVID but then recover, there's this issue of post-acute COVID or long hauler syndrome. And there's more and more research coming out on this. And there was a particularly interesting article in the Lancet where they looked at people 6 months after they were hospitalized. And this specifically looked at about 1,700 patients they were all hospitalized, but the majority of them were not severely ill. Only 4% of them were in the ICU. And then the median age was 57. At 6 months, 76% of them reported at least one major persistent symptom. 65% of them, that symptom was fatigue or muscle weakness. 26% of them had sleep difficulties. 24% of them were unable to walk at a regular pace because of shortness of breath. And 23% had significant new anxiety or depression. So it just speaks to, we talk a lot about the death toll with COVID-19, which is certainly important, but there is this, when you have 22 million people who've had an illness, if 76% of them, of the ones who are hospitalized, have these persistent symptoms, it's an important factor for us to consider, especially as we're talking about the role for vaccination. I wanted to talk a little bit about the issue with distribution of vaccines on a national level. So this is something that CDC has started to keep track of. So if you look at the data anyway that was available yesterday, each state was given approximately 6,000 vaccines per 100,000 residents. And curiously, Hawaii was given 12,000 vaccines per 100,000 residents, which I would argue is yet another reason to move to Hawaii. As far as vaccinations that were administered per 100,000 residents, the dark blue states are ones where more than 2,000 vaccines have been administered per 100,000 residents. And you can see that New York State is one of those states. We're at 2,235 vaccines per 100,000 individuals. So I did want to go over a couple of additional frequently asked questions, because as the vaccine rollout happens, I think a lot of questions do come up. And not an uncommon question, especially as we get into group 1B, is, if I'm a young, healthy individual and I don't have any risk factors, when I do fit into a priority group, should I get vaccinated? And my answer to that is yes. So although your risk of death from COVID infection is low if you're in this category, risk of hospitalization and long-term complications is both real and unpredictable. Secondly, the vaccines that are available are safe, and they're certainly safer than getting the infection. And third, and something that I really want to underscore, is that because vaccination is expected to reduce the spread of COVID to the more vulnerable members of our community, by getting vaccinated, you're essentially doing your part to help stop this pandemic, and also, frankly, to help restart our economy. Another question that comes up is, can you get COVID, the infection, from the vaccine? And the very clear answer to that is no. And it's important for people to understand that none of these vaccines contain any live or dead COVID virus. The vaccines have what's called mRNA that basically acts as instructions for our cells to create a sample of the spike protein. And then our immune system creates antibodies to this protein so that your body is prepared when you're exposed to the real virus. So unlike some other vaccines, there's actually no COVID virus in the vaccine. A question, and Dana alluded to this, is how long will immunity from vaccination last? And one of the challenges is because these vaccines are new, the science can only keep up with the time frame that the vaccines have been out. But what we do know, and this was just published, is that there are protective antibodies from vaccination, specifically with the Moderna vaccine, for at least 4 months after vaccination. And what we do know is that with natural infection, we see that immunity may wane at about 90 days, and we certainly see reinfection after 90 days. So there's hope that the vaccine is at least equivalent, and maybe some evidence that the antibodies are more persistent after vaccination. And this was something that was published in the New England Journal just recently. As far as another frequently asked question is, does the vaccine change my DNA? So there's people who are concerned about being transgenic and other things. So the answer to that is no. And again, it's mRNA, which stands for messenger RNA. And so it's genetic material, but it contains just instructions for making proteins. Once it gets inside the body after the vaccination, it gets into the cells. It mostly stays in the cells in the arm where you had the injection. And then it has those cells produce these spike proteins. Soon after the cell makes the spike proteins, the cell actually disintegrates the mRNA. So after several days, that mRNA is gone. And it never enters the nucleus of the cell and never modifies the DNA. And I should remind people that this is actually unlike real viruses. So when real viruses infect you, sometimes they do alter your DNA. And with things like HPV, that's actually part of how people can get cancer from certain viral infections. So vaccines do not change your DNA. They don't use DNA. Another question that comes up is some people have said, I've heard that the vaccine, especially the second shot, has a lot of side effects. What I would say is that common symptoms after vaccination, which are really just a sign that your immune system is working and that your body is developing immunity, do include a sore arm. And having spoken with a lot of my fellow providers and other people who've had the vaccine, I think you can pretty much count on getting a sore arm. Some people get muscle aches and joint aches. Some people get fatigue. Some people get headaches. Some people get fever. Almost all of these symptoms go away after 1 or 2 days. We do rarely see more significant things. Some people develop hives, which are easily treated with something like Benadryl. And we have seen now that almost 2 million people have been vaccinated that anaphylaxis can occur. So that's a more serious allergic reaction. It's much like what you hear when people have an anaphylactic reaction to peanuts or bees. All of the individuals that we've seen have these reactions have been successfully treated, and most of them just go home from the emergency department, unlike people who have severe COVID, for instance. But I would point out that there's a significant variation between individuals, and people respond differently to the different vaccines. Most of the side effects or most of the symptoms that people get after vaccination are treatable with things like ibuprofen and naproxen, if people are able to tolerate those, and also with Tylenol. I do want to mention, especially as people are starting to get vaccinated, it's important that people realize that you're not supposed to pre-medicate. So although you can safely take acetaminophen or Tylenol and things like ibuprofen after you're vaccinated, we specifically recommend people don't take these medications just prior to the vaccination, because that can make it harder for your body to develop the antibodies it needs. And finally, I would just say that all the symptoms that people get for a brief period of time after vaccination are a lot better than getting COVID. So since I'm talking about this, I should say, by the way, I did get my second vaccine and also just had very mild symptoms for about a day afterwards. I wanted to point out that when I surveyed one of our local health systems to ask both the physicians, the nurse practitioners, and the PAs to see what the rate of acceptance of the vaccine was, of the group of people that I surveyed, 217 of them, so that's 97%, agreed to be vaccinated and have started the vaccination process, and only 3% declined. And the people who declined for various reasons, including sometimes particular health concern. Nationally, at this point, we've had nearly 2 million people have been vaccinated, and at this point it might even be 2 million. There still are not significant adverse effects other than what I just described. The CDC does have a very sophisticated monitoring tool to keep track of this. And again, they're documenting that anaphylaxis, which was the main concern, remains rare and treatable. I did also want to just touch on the issue with the variant of COVID. It's called the B117 strain. We talked about it last time. The questions that I brought up before, we are now having some answers. So as far as is the strain in New York State, as of yesterday, or actually as of last week, we had 1 case. As of yesterday, the most recent information I could find is that we have at least 4 confirmed cases. In New York State, there are 3 that are all related in Saratoga, but there's 1 that's unrelated in Nassau County. And because none of these people travel, the sense is that it's community spread, and so it's likely present in other parts of New York State. The question comes up about tests, and anytime the virus changes, you want to make sure that the tests you use to detect the virus are still accurate. And the answer to that is yes and no. So the FDA did send out an alert that there are 3 specific kinds of tests that are compromised and are now less accurate. I did confirm that none of these 3 tests are the ones that are used in St. Lawrence County, and that's something that we'll continue to keep an eye on. So the answer is that all the tests in St. Lawrence County are just as accurate for the variant as they were for the previous version of COVID. As far as whether the vaccine is effective or not, there is now some scientific studies. There's one out of the University of Texas that seems to demonstrate efficacy, at least against some aspects of the strain. So our sense is that it will be effective, and the preliminary actual bench research seems to be confirming this. The question remains, is this strain more deadly? Again, we don't think the strain itself is more deadly, but because it's more contagious and more people get it, more people are likely to die. And then the bottom line, which is a little different theme tonight, is that anytime a virus is allowed to exist in the population unchecked, it gives the virus an opportunity to mutate and change. So it really just means that we need to redouble our effort at all the public health measures, and also that we really need to push the vaccine campaign forward so that we can get a hold of this virus before it has the opportunity to mutate to more and more different strains or variants. And that concludes my presentation. And I think Dana and I are available for questions.
Mr. Reagan?
Doctor, thank you very much for all your efforts on our behalf. Now as we've entered, B1 is now eligible. These people who are now eligible are, beginning to look for where to get their vaccinations. What should we be telling them, and how long should they expect to wait until they're able to get one?
Dana, did you want to answer that, or Jim?
Yeah, I can start. So that's one of the things is we are waiting to hear a little bit more about 1B and how vaccine will be distributed. So as I mentioned, the Public Health Department is waiting for its shipment, and hospitals have not been informed yet how their supply is going to change from what it was in 1A. So there's a gap to know how much vaccine we have to open up how much registration we can do so we actually have vaccine for those people who have a slot. So there is a call with the state this evening that we have to attend, and so hopefully we'll get some of that information.
If I can just follow up. So if someone calls the hospital tomorrow, what answer are they going to be given as far as when they can get a shot?
So as far as I know, it depends who's calling. Those who are 75 years and older are being serviced by pharmacies. So going through the pharmacies to find those answers would be most helpful. There is a hotline that was supposed to open on New York State Department of Health's website to answer questions about who is being vaccinated and how to go through that process. But that's really all the information that I'm aware of right now, and so we're waiting to get more information from the state.
Mr. Burke?
Thank you.
Dr. Wams, maybe I didn't hear that correctly, but did you say that there was 6,000 per 100,000, 6,000 vaccines that have been distributed per 100,000?
If you look at each state from the CDC website, as far as I can tell, it indicates that somewhere right around 6,000 per 100,000 were delivered to each of the states in the U.S., again, with the exception of Hawaii, which had 12,000
And that's general population, the not eligible population.
I think the 100,000 is just 100,000 residents of that state.
And 2/3 of those, I think you said 2,000, the ratio was 2,000 out of those 6,000 have actually been administered.
That's the statewide average.
How are we doing?
We are higher than that. And in fact, I think there was an article in one of the newspapers that the North Country region actually has had the most effective distribution program relative to the other regions in the state.
So we would have we have a population of 111,000, which, if my math is correct, we should have received about 6,600 or a little over vaccines. Is that in the ballpark of what we received?
Dana, I believe so. It's a little confusing because they're distributed to the different hospitals.
Yeah, so I'm not sure what we've received. We're able to pull a report in the NICES system, which is the New York State system that logs all of the immunizations that people get. And that is the system that public health does ordering through. And it's also the system that hospitals have to log which vaccines that they've given. So when I look at what we pulled this afternoon, it shows we've done about like 4,400 vaccinations here in the county. We'd have to go by what the hospitals have done because Clifton Fine, Claxton, and St. Lawrence Health Systems all have done vaccinations. And I'm not so sure we're getting full reporting of what pharmacies are doing because keep in mind they were supposed to do vaccination of the nursing homes, both staff and residents. So we're still trying to check to see if all the reporting is going into the system.
But I think, Mr. Burke, that answers the question in part that we've done more than 4,000 in a population of roughly 100,000. And I think it's very likely that the pharmacy vaccination of the nursing home populations, which include their staff, so it would be a substantial number, would be on top of that. So that would put us at a very high rate of vaccination. Mm-hmm. And I will say, although there are certainly some challenges that the community faces in terms of need, understanding who we can administer to, we're going to strive as a Board of Health and Department of Health to be the best county in terms of getting the vaccine to people.
Thank you.
Mrs. Haggard, you have your hand up.
Thank you, Madam Chair. I would like to share this bit of information on North Country Now. There's an excellent article about kidneys with a link, and it explains how to get an appointment for those 75 and older, the forms you need, the appointment scheduler, if you need a ride, how to get a ride, and facts about the Moderna vaccine. And that's on our very own official newspaper, North Country Now's website this evening.
Any other questions or comments? No, seeing none. We will go on to, I'm sorry, Nicole, I didn't see your hand. Go ahead.
It's okay, thank you. It's a little premature to ask, but I had mentioned at the last meeting, those that have the higher priority health complications along with COVID, I see that they're not listed yet, so I'm assuming they're going to be in 1C. Being that we've started 1B before 1A is finished, will 1C begin before 1B is finished, or will we have to wait for the people that have compromised health conditions? Will they be waiting until June, July? Do we have an estimated time frame on that?
I haven't heard anything yet on 1C, Dr. Williams. I don't know if you have. I heard that to do the completion of 1A and 1B, it will take 14 weeks. But I don't know if there'll be some of the overlap between the phases. I have not heard yet.
And I think it's fair to say that this is a rapidly evolving issue. And part of, I think what's been a challenge for Dana and for the hospitals and for the pharmacies is 1B was initially projected to start next week. And because a lot of pressure to get 1B going, it actually started, if you look at all the messaging, essentially 1 week early. So a lot of the preparation, while it's been in the making, if you shift the start date a week early, it just presents certain challenges. I think there's going to be pressure to get through 1B as quickly as possible and get onto 1C. So you may see that kind of initial, it's going to be 14 weeks, but then 6 weeks from now, suddenly we're talking about it. So I think we're just going to have to keep the communication lines open, make sure the public is informed. As we learn, what's going to happen from New York State Department of Health, we'll make sure to communicate it to you folks and to the community in general. But again, what we will ensure is that any vaccine that comes to St. Lawrence County that we have anything to do with will get injected in recipients' arms who are interested in vaccination just as quickly as possible. And there's going to be more and more, I think, public measures of that. And I think you guys should hold us to doing that kind of a job.
Go ahead,
Just
Nicole.
thank you. One more question. I'm just wondering, because of the large number of people that are going to be vaccinated as part of 1B, would you recommend that people start calling the hotline to schedule appointments, or would it be recommended that they wait for advice from their employers? I'm not sure if employers have plans in place where they'll be vaccinating their staff. So I'm just wondering, to not bog down systems, what would be the best avenue for people that are part of that 1B group?
So that's a good question. So the public health department can make links for registration, but we have to attach that to an allotment of a vaccine. So we have to wait until there's vaccine to put out there. And that's one of the difficulties, is without knowing what vaccine is available, it's hard to know how many slots to open. And so we are working very closely with the hospital system. So whether it's our vaccine or the hospitals, we hope to put those links out there as kind of quickly as possible. Pharmacies are doing it a little bit separately, but we're staying in contact with what they have too. So I think if we can gain a little bit more information, we will pass it out. We'll make sure that we get it to the workforce too, so that the employers can provide it to their employees. But at this time, it's really hard. There isn't a link to go to register yet, and it's because we're waiting for the supply of the vaccine.
Mr. Akers?
So last week, Governor Cuomo was on the news, and he was threatening hospitals with $100,000 fines and then $1 million fines if that you actually administered the vaccine to somebody who actually was not in the phase 1. And was any vaccine sent back? Were any hospitals fined, or was any vaccine disposed?
So, no. As far as I know, nobody's been fined or is under, investigation or anything. We were able to, through communication and collaboration with all the hospitals in St. Lawrence County were able to utilize the vaccine that was distributed to them, and none of them had to return any vaccine. And everyone's been as careful as they can be to make sure that people who were in the 1A priority group were the ones who were vaccinated.
So I knew that there was 248 doses at the Star Lake Hospital. They redistributed it to another facility, or did they find arms that qualified?
I know in our communications with them, they found people to be vaccinated.
Okay, thank you.
Any other questions? Okay, I guess we'll move on to resolution. We have a resolution from the Sheriff's Department. Do we have the sheriff someplace? Sheriff here. Oh, okay. So I have a resolution authorizing the purchase of body cameras for the Sheriff's Office and modifying the 2021 budget for the Sheriff's Office. Do I have a by Larry Denisha, seconded by Dave Forsythe and Jim Reagan. Go ahead, Sheriff. Sorry.
Are you guys seeing the PowerPoint in front of you?
Yes.
Okay, thank you. So good evening, everyone. So So I have just 4 slides here to somewhat explain the body cams and the resolution, and then obviously you'll have some questions after. My undersheriff is with us also, and he's the one that did the research on the body cams. So if we need to get his information, we can have him chime in. So Police Reform Executive Order 203, and if you read the order, strongly recommends body cams. I've been a proponent of body cams for a couple years now. And we did a cost analysis of this with many different companies. We came down to $60,000 from the Exxon company. As you can see, they're very highly credible throughout the country. Many police departments, sheriff's office use this company. They're kind of tried and true of what they've been doing for years. And included in it'll be a 5-year contract starting this year, 2021 through 2025. And what it includes is your licensing fees for 5 years, the cloud storage. We checked with our IT department. We also did some other work with Exxon to put this on our county server. There was a couple difficult issues. One would be the size of all these cameras, and the download would be take an immense part of our IT server. And the second is the discovery. We can't really have discovery information. You remember the discovery laws we talked about last year. Those can't be on a public or a county server. They need to be on their independent owned servers. Hence, we went with the cloud storage service, because that was just cost effective and best all the way around. So we're going to go to a cloud storage instead of a IT using their space on their servers. What we're going to get with this package is 32 units. We have 32 deputies on the road patrol. Each deputy will have their own individual camera. Obviously, we don't want cross-contamination or not enough cameras to go around. This way, each individual officer have their own cameras. In the package, there's also 2 spare body cameras, so we'll have a total of 34 in case, obviously, one breaks. We have a spare to give to the deputy, because we want to utilize these at all times. It comes with a charging docking station, which downloads all the information once they enter these into the docking station, into the cloud automatically, updates the cameras, and it charges them. So that's nice to have, where that makes it user-friendly for the deputies. We also have a maintenance agreement with this package. And we actually have Exxon people that come to our station and give tutorials and kind of deploy the cameras to our officers. So it's a pretty extensive package. And again, my undersheriff did a lot of work on these, months of work, asking other companies with certain regs and schematics and the cost. So the Exxon one really, for what we wanted out of this, was the best cost. This is the unit you see in front of you. This goes on the officers. They may wear a vest, it may attach to the vest or to the front of their uniform. The top part is the camera itself. The bottom is the button that turns on the recording for the officers. There's some safeguards with the recording options. The big button on the bottom, you have to push it twice to activate your record. You have to hold down on it like for 3 seconds to make it not record. So if you're thinking, well, they're going to bump it and it's not going to record, they've thought of that. So that big button right there, you have to keep pushing that for 3 seconds for it to go off. On the top of the unit, you can't see, when the officer looks down, he can see if it's recording. There's a red button shows that it's recording. When they record, an audio beep is used, or they can use a vibrate option in case they don't want someone to know the recording for certain aspects. So there's different ways that they'll know the camera is being used. It's powered up for the whole shift. Then you record with the button in front of you. So it's kind of a different option. And we have guys that do work 12-hour shifts that will be using these. We've been testing these. I'll talk about this in a minute. We've been testing these with 4 of our officers on a pilot program, and they will last 12 hours. So if you think it's not going to run for 12 hours, we tested it and it will last that long. So why do we want body cams? Obviously, the resolution spells out the executive order. That's pretty important. But if you look at these bullet points, a lot of these are from the executive order. They want to show transparency, and we do also. Accountability of all of our officers. It collects the data. We retain that data in the cloud. and we want it for documentation purposes for the following reasons. It helps confirm the nature of events and supports accounts that are articulated. We can use it for evidentiary purposes, corroborating evidence, use of force issues, and that was big in the Executive Order 203 was the use of force, and they really pushed the body cams. So this kind of checks a box in their minds. If we have civilian complaints, obviously we can go to the video and we come up with quicker resolutions. We can have training opportunities, as I mentioned in a previous conversation with you about body cams. When I talked about the Executive Order 203, I mentioned that we had one of the officers was wearing a body cam during one of our vehicle pursuits, and they were, if you ever know much about tactics, we don't only want one person talking at a time giving commands. We saw in the video that there was two officers at times that were making commands, and that makes it confusing. So obviously, when it comes to training, when it comes to felony pursuit takedown, we're going to talk about only one person talking at a time. That's one example of many that we can go through, but I don't want to bog down on that. And also, obviously, with body cams, and they've done studies that we have fewer lawsuits and litigation, and those departments have body cams against those that don't. Again, I'll reiterate, we had a pilot program in the last 3 or 4 months where we had 4 officers that have been using these since October 1st. And if you think the officers don't like the body cams, it's actually flipped. They do like the body cams. They, just for the reasons on the last slide, for the most part, but there's been a lot of positive feedback from our officers that have been wearing these, that they really like them and they're glad to have them. So, and I'd like to hear that from our officers. And again, I talked about a felony stop that we documented already. We've had some cases where we've used it for evidentiary purposes, i.e. a DWI. They're doing tests in front of the cameras that are recorded. It helps for prosecution. And we've already had established a policy. We've reviewed this and approved it before they started the pilot program. We obviously wanted some policy out there before they even started using them. So we've already reviewed the policy and approved it. We use this for training. Obviously, if we do get this passed, and I hope we do, and I'm a big proponent of it, there will be a year-end review every year of our body cams and the footage. What can we improve on? And obviously, we will implement those changes, not only in practice, but in our policies and procedures. So I give a lot of credit to my undersheriff. He's done Loman's job on research with the cameras, getting the policy set for the cameras, getting the pilot program for the cameras. He's done an excellent job, great feedback, and as you can see, it's something that the executive order really is pushing, and I'm a big proponent of that. So with that, questions from anybody?
Thank you, Brooks. Are there any questions? I can't see the screen. Mr. Reagan, go ahead.
Sheriff, I just want to commend you for being proactive on this and for having our sheriff's department lead by example for the entire North Country. And I really believe that your leadership on this issue is going to go a long way to helping people realize that your department and our law enforcement community is committed to fair treatment for everyone.
Thank you.
Thank you. Mrs. Haggard?
Thank you, Madam Chair. Sheriff, I had the pleasure to speak to the undersheriff this week, and I'd love him to explain. The question I asked was in the procedures, and I've just kind of made note of this through the news or whatnot, is that these officers that aren't doing the right thing will turn on. And maybe, if you don't mind, if Officer O'Brien could speak to what he told me. I thought it was a great answer.
Sure, Sean, do you want to address that?
Yeah, so first of all, good evening, everybody. Yes, so as we go through this process of body cams, obviously we've developed a pretty extensive policy, as the sheriff has already explained. 4 pages to be in fact. We've gone back and forth, had a good dialogue with the union. We've reached out to the State Sheriff's Association, and this company, Axon, is what we considered a gold standard in the United States for body cam. So they also want the program to be successful, as all the reasons the sheriff has already previously explained. Having said that, the procedure, certainly in any of our policies that we have, if in the event that an officer isn't doing what they're supposed to be doing, then obviously we'll progress through the counseling and ultimately the disciplinary process, right? You know, we're here with an open book and fully transparent, and want to ensure and continue to have the public's trust in doing what we need to do to make sure everybody's safe.
Thank you very much.
If I can add on to that, obviously with the implementation of a new system, there's going to be some human error, and we have to take that into account. But they do know there's policy that they will follow regulations, and if they don't, there'll be consequences. Again, I think the explanation of how the body cam works, it's not foolproof, but them turning it on is there's with the lights and the audio and how you turn it on, how you turn it off. Hopefully, the way Exxon set that up, we won't have to deal with that. But there is human error. I'm not going to snow anybody here. And obviously, if it occurs, 1 or 2 times with one individual, it'll be addressed. But as I said, very positive feedback from the deputies so far on the pilot program, that they want these on because they're professionals and they do a great job, and they want to show people that they're doing the right things out there. So this is a good thing for deputies.
Anyone else? Okay, I guess all those in favor?
Aye.
Any opposed? Motion carried. Next up, we have Jason Fotenhauer.
He has one B.
Oh, I'm sorry. Oh, you do have B. Sorry, ongoing measures regarding police reform discussion. Sorry, guys.
That's okay. Just give me a second to get it up on that screen here. Are you all seeing that?
Yep. Yes.
Okay, so last week there was a question about the executive order of police reform, and I kind of ducktailed into what we're, although we're passing this resolution last week, the work doesn't end there. And obviously there were some questions out there about, okay, you passed this, now what? So I wanted to give a presentation about what we're planning on at the sheriff's office in 2021 as far as police reform. And hopefully this will answer a lot of your questions. If you're not, after this is done, obviously I'll take any questions on this. So there's 6 categories that I'm going to explain on this presentation about what the sheriff's office is going to do for 2021 when it comes to police reform executive order 203. And the 6 categories are here in front of you: education, training, body cams, implementation of new laws and procedures, reviews, and public group forums. So I broke it up into 6 different groups. So there's quite a lot that we're going to do this year coming up. And I'll preface it with saying some of these may be delayed because of the COVID pandemic, obviously. So we're going to do these as much as possible and get through the COVID. But our intentions are the next 6 bullet points. And I'll go one by one through these. So I'll start with the education component, which is very important. If you read executive order, that the training and education is really what they push a lot. And one of the courses that just came out really recently, the last couple of weeks, was a course called Procedural Justice Training through DCJS. Now, DCJS is Department of Criminal Justice Services. That's our department that regulates all of our trainings, all of our certificates, and what we need to perform to stay certified as a police agency. So they're kind of the agency that runs all law enforcement agencies in the state. So if it comes through DCJS, that's what we have to abide by. So they want this training out there, this procedural justice training, and there's 2 sections of it, 1 and 2. The second one is 6 months after the first one. And it talks about procedural justice models of policing, which emphasizes transparency, which we talked about tonight already with body cams, explaining police actions and responding to community concerns, and sensitivity training And we talked with our stakeholder groups. There was 2 or 3 of the people that were in that group that really want to talk about sensitivity training. And if you don't know what that is, it's kind of looking at it from not just the police officers' respect towards the people they deal with, but the people that they deal with and how they would see police officers interact with them. So, which is a great premise that we have to kind of put ourselves in their shoes at times to see they're dealing with law enforcement, and sometimes it's a scary event, or they've never dealt with law enforcement, or they don't know how to relate to law enforcement. So it kind of puts the officer in the shoes of the people they're dealing with, looking back at the police officer. So that's a great idea, and we're going to get this training. There's a certified, and you have to get a certified instructor to instruct this to your agency. And right now we're in conversations with a local instructor from SUNY Potsdam, and we're trying to see if he could get this section 1 done for us. And then in the future, when COVID does subside, we want to get one of our detectives to go down and train so he can train the trainer to get this certified. So we would love to have someone that was already certified to teach this, but in some trainings that the state makes these certain certifications, the officer has to go down and have a week's training to be certified to instruct this. We do it with our lie detector, with canine, with verbal judo. I'm going to talk about in a minute. There's certain people that can only instruct it, and you have to go through extensive training. So we're looking to get this into our office. Again, with COVID, people have to be patient. It's not going to be done this month, obviously, but when things start subsiding, we want to get this training done. The second educational component, this also is very new, is they want a new course. This comes from DCJS. It's called Fundamental Crisis Intervention Skills for Law Enforcement with People with Disabilities. And I started reading up on this, and some of this was new to me also. But it's going to pertain to people with autism, Tourette syndrome, epilepsy, traumatic brain injury, dementia, Alzheimer's subjects, learning disability, ADHD, deaf, hard of hearing, and physical disability. So it's a wide range of people with disabilities that you have to try to deal with out here in the public. And this statistic, I didn't look at this until I started reading up on this, but 30% of people that are killed by law enforcement have some sort of disability, which that's a big number, 30% to me. So this course really is apropos, not only with Executive Order 203, but what we should be training for anyway. Now, we have some training in the academy and throughout our other trainers, but probably not to this extent, which this is a good thing. And the next bullet point was really glaring to me. It was approximately 50% of minority individuals that have dealings with law enforcement have a disability. So we have to recognize that these bullet point number 2 is out there, and our officers in the last bullet point have to identify these, recognize that first, that these are the type of people that we're encountering out there. We have to identify these people. How do we approach them? How do we deal with them? How do we interact? And then how do we respond? So it's a pretty good course, and this is new, and it's just coming out. And obviously we want to get this under our belt as soon as possible. But it's a pretty good course that the state's putting out there, and we will get it done. Again, with COVID, it could take some time, but that's our plan, is to get this done by the end of the year. The third educational component is our academy that we have yearly. It's starting pretty soon. Actually postponed for a week due to COVID concerns, but we're going to try to start on the 20th. And we have meetings with our board of directors, myself, and all the chiefs are members of the board, and the academy director and the SUNY chief, Mulkin, are part of that board. And yearly we review always our agenda that we're going to propose. Our criteria and our curriculum all get passed down to DCJS, and they have to approve this curriculum, or else we don't get an academy. So we're dealing with them all the time, DCJS, when it comes to the academy. And I can tell you, in the academy, one of the added on trainers was that one I just spoke about in the last slide about fundamental crisis with disabled persons. That will be taught to all of our cadets right away. Verbal judo is something I'm going to talk about for our department, but that is taught every year, either by myself or Chief Murray, and we are certified. We're the only ones certified in the whole county to teach that program. It's a de-escalation program. It's close, dear to my heart, because I'm the instructor of it. But it's a de-escalation process. We use steps and many things. I'll talk about that a little more in a minute. In the academy, we had bias training, procedural justice training, and many, many more, that domestic and violence, and I could go on and on about what's trained in the academy. But this slide should tell that we do take this serious with our cadets, a lot of training, and the DCGS has to approve our curriculum. When we get into the training aspect, our use of force was a big thing on Executive Order 203. That was a big chapter, if you will. And we already have an annual Article 35 training. I know I mentioned this last time I talked about police reform about a couple months ago, that it's mandated that it's Article 35 is as a training component yearly for our officers. But we stress more and added on, just not about use of force, but our officers will teach de-escalation techniques during Article 35. And then we have another component where our defensive tactics, that's another part of our training that we have to have every year, defensive tactics, so many hours of defensive tactics. Those instructors through the state had to go through another additional training this year since police reform. And our officers have already completed that training for our defensive tactic instructors have already completed that. Another training, and this comes from our shareholder group that met. They highly recommended our officer wellness training. And there's a chapter in the book about executive order. It's just, there's many chapters, but one did talk about the wellness of police officers out there. And we deal with stressful situations, and stressors are in our lives. Everybody has stress, obviously, but officers are dealing with some very stressful situations out there. And if they're not healthy when it comes to their mental health, we don't want that to be a problem when they're on the road. And that's what they're finding out, is that when they're not mentally strong or they have some issues with stress or stressors, that they don't perform as well. And we don't want that. So this was one of the recommendations from the shareholders group, and it was a great recommendation that we train our sergeants, which are our first line supervisors, to recognize stressors and stress in our officers, and to make sure that we can sit down with them and debrief them after a stressful situation. And we want those sergeants to be trained. We have a chaplaincy program, and our 2 chaplains are certified actually in these debriefings. So we're going to use them. And during our shareholders group, we had a mental health counselor that was on our group, who's an awesome person, but a great counselor. And we're going to work with her to get further training for this officer wellness. So I think it's a big proponent of executive order, but it's also a big proponent of the mental health of our officers out there. And I care for them, and we want them to perform at 100% at all times. Another part of the shareholders group was to promote our positivities out there in the media, on our websites, our app, our Facebook. They talked about, we see a lot of people getting arrested. You got a lot of your media release forms out there, but you don't talk enough about what positive things you do for the county. And it was a great, check for us that, yeah, they were right. So we're starting to put out more programs that were offered, our services that are offered. I can tell you, we just put our Yellow Dot program out there last week. And if you don't know what that is, you can come to our office and fill out some forms. You put a sticker on one of the driver's side rear window. Anybody that has to deal with them with EMS or rescue, if you're involved in an accident, sees that sticker, they know enough that there any issues that you have medically, or there's this form put in your mailbox, they can pull it out. And obviously, if you're diabetic or issues with heart issues or whatever it may be, they know right away what they need to be able to treat. So, and I can tell you, I talked to my undersheriff, and we pushed that out to people, and it pushed out to 37,000 people. That's a big number. So those are the things we want to get out there to promote positively that we do out from our sheriff's office. And we also want to get training for our deputies. We have like 2 designated deputies that push out things to the media. We want to get those trained to make sure they're doing everything we can to get a positive message out from the sheriff's office. Next training is, I kind of touched on a little bit, as verbal judo training. It's a de-escalation process. And it kind of uses a step system. You learn how to use certain steps with certain situations. The certain steps that used for a traffic stop might be different steps than using for a volatile situation. It really helps out with asking the person what's going on, setting a context, and how do you act from that situation. So we're going to have a refresher this year. We do it in the academy, but we want to start in the sheriff's office where I'm the instructor to do a refresher for all of our deputies, because it's kind of a de-escalation thing that it wouldn't hurt to have a refresher on to keep it fresh in the deputies' minds. We talked about body cams. I'm not going to get too much into this, but obviously we'll fully implement this now that we've passed this resolution. We will continue to review footage through the supervisors and my undersheriff. And at the end of the year, we'll have a review on where we are with body cams. And again, any changes that need to be made, we'll enact those. I'm going to talk about this briefly, but there's always new laws that are coming out and procedures. I named a couple of the trainings that have come out just in the last couple of weeks that we're going to implement. This is a fluid situation with Executive Order 203. And I expect more things this year that will change, that we're going to have to amend to and enact. And we're following all the procedures again from the Department of Justice Services. So those come down to me all the time. And any additional things that will be added to 203, obviously we'll enact those. When I say review, just like the police reform, I always say this to everybody, it's not a negative thing, it's a positive thing. It doesn't hurt to look through everything and review and come up with some improvements that you can make. Nobody's perfect. Improvements should always be done. And I always take this as a positive measure. And I want to let you guys know that I take Police Reform Executive Order 203 very seriously. And I understand it's a big responsibility for the sheriff as the only elected official in the county to kind of drive this regionally. And the undersheriff will know that through our chief meetings that I've given out assistance and will continue to give out assistance to all the police departments or anybody that needs not just help with police reform, but in any aspects of police work that's being done in our county. So our review of our accreditation every year is already mandated, so that will be done. But reviewing our policies and procedures and our evaluations that we do with our office, which we already do on a yearly basis. As a matter of fact, we're doing those in January, is very important for police reform to get a litmus test to make sure that we're doing everything we can. So every time we do an evaluation with our officers, we always repeat the mission statement. They actually have to sign off that they've read the mission statement. So that's reminding to them what we're about and what we're supposed to be doing for the county residents every year. And we give them positives, but we also give them corrective measures. Nobody's perfect. And we monitor those corrective measures as the year goes on by our supervisors. So we're always reviewing things, and these things are not a bad thing for police reform. When it comes to public group forums, as we continue into 2021, as I said last week, it doesn't end here. Just because you got a resolution that passed police reform doesn't mean, okay, you send it into the state, you're done. Far from the truth. As you can see by the previous slides, there's a lot of training, a lot of education, a lot of review, but there's a lot of things that we want to do for the public. And part of the public reform is having these town meetings that I've talked about and having them regionally. Again, with COVID, we're going to be delayed here a little bit, but once we get past this, we're going to start this, and my undersheriff will drive this. And I've already had a couple of legislators that want to come with me to these reforms. And I welcome everybody. When I'm in your region, 3-4 legislators sitting at the table with me would be awesome, because they're probably not going to just want to know about police reform. They may want to know about some other things in their area that you guys can answer. So going forward, I think this would be a great idea, just not for police reform, but anybody that wants to join us and talk to the public. I mean, they like these things. I've been to some of these forums, and they come out in mass sometimes. I had a one on community watch program in Louisville, and I bet you there was at least 100 people sitting in those seats asking a lot of questions. And I liked it. I thought it was great interaction, and I look forward to those community events. So other than that, we have college forums that I've been on, and I know Chief Moken called me about a month ago, and I know Canton College is trying to get a forum together that I'll be a part of. Obviously, we continue with our chiefs. We have meetings probably every quarter or so to talk about many things, not just police reform, but that interagency cooperation is out there. And the one thing I want to talk about is future implementation of a program that I've been reading up on for seniors and the public. And obviously, we're dealing with a lot with scams and phone scams and internet scams. I don't know who hasn't got a call from a phone scam. I bet you everybody in this room would raise their hand. But to get that out there where we can have some training and a community forum to answer those questions from the public and the seniors about, what should I be looking for and how do I go forward? Not just with that, but with home safety measures. I get a lot of those questions also. So to get some sort of program out there that speaks to this is something I want to implement this year also. So it kind of piggybacks on police reform, but it's a sidebar issue too that I think the sheriff's office should strive to get out there to the public for something that's where many people deal with. So I'm looking forward to getting this enacted as well. So with that, I spoke as quick as I could because I know some people think I can be long-winded, but I welcome any questions on what I perceive to go forward with in 2021 as far as police reform, Executive Order 203.
Any questions? Seeing none, we will go on to planning with Jason Fodenhouse. Thank you both, Brooks and Sean, for coming.
You're welcome.
Thank you.
Go ahead, Jason.
Great, thank you. Good evening, all. I want to give you our monthly update on the lead grant, the HUD lead grant that we've been working on for some time now. We have finally begun to make some good progress on the high cost unit problem that we've talked about before, where the HUD, the federal government, has a cap of $20,000 per unit, and we've had to be back and forth with our HUD representatives about this cap and how it's really, very difficult to do the work that we need to do for that amount of money. And we were able to get an override of that cap for a project that we're working on right now, a unit that we're working on now. So we're hopeful that will sort of be a precedent that we can use moving forward to get more units done. That we won't probably meet the same threshold or milestone number, but we'll be able to use the amount of funds that have been provided to us. So to go along with that, we did have a regional call. They happen probably quarterly with our HUD representative, and there are a number of participants in the region here, including New Jersey as well as New York. But on that call, there was a request by our HUD representative to put together some information about the struggles and the challenges that we are facing with this program. And so there's an individual, the program manager for a lead program down in Utica, New York, that has agreed to sort of collate all of these issues and is in the process of putting those challenges together. And I think this is, again, a good sign that HUD is realizing that the program, it just doesn't, it's not the same size fits all for everyone. So we've provided information to the Utica office, and many of the challenges that we provided to them, I've already expressed to you. Some new ones that have come about as COVID continues on, and just with other issues going on in the country right now, problems that we're discovering most recently are just the incredible material cost increases. We've seen cost jumps of up to 25% with some materials, most specifically any vinyl product. So vinyl siding, vinyl soffit that you would replace lead-based paint siding with, as well as windows. A lot of the projects require window replacement, and vinyl windows are what is used. And so we're seeing a high cost. So that goes into the first point, I think, that we are making some progress, but we're not alone here. We're finding these prices are just going up, certainly in our region and in other regions across the country. The other issue is the lag time in supplies. We're seeing where we were able to get supplies in 2 to 3 weeks is now taking 10 to 12 weeks for some supplies. So that again, that can have an impact on production for these projects. So making HUD aware of concerns, making them aware that hey, it's not just St. Lawrence County that is struggling with these challenges. It's everyone. I think will be beneficial moving forward for the program in its totality. A couple other items. Just we have a van, a volunteer transportation coordination or VTC van, as well as 2 buses, transit buses that have been decked out with advertisement for the lead program. You may have seen them around the county. We have a 3rd bus that is going to have lead advertisement on one side and the 5 pillars of prevention on the other side. And that is something that we hope to have through the shop in the next couple days to get that out and then get it out on the roads for advertising. And I'm happy to answer any questions if there are any on the lead program.
Any questions? I'm seeing none. I guess we're going to move on to vacancy review committee group.
Good evening. We held the first meeting of 2021 on January 5th, and there were 9 requests from 5 departments provided, 2 of which are on this agenda, and the 3 remaining will be on your services committee agenda. We have governmental services going first this evening, and I believe Dale is with us. Good evening, Dale.
Hello, how is everybody?
Good so far. Can you speak to the building maintenance worker, please?
Yes, this position's to fill a retirement we had at the end of December. This position is basically a general maintenance person. He works evenings, basically Saturday through Wednesday, get my days straight, and plus holidays. Does a lot of maintenance off shifts when people aren't in the building, and it's hard for the day shift crew to do some of the repair. The person that vacated the position was an excellent carpenter, very talented individual, and we're really hoping we can get somebody as talented. He's able to do a lot of projects that a lot of people couldn't do. So it's he was able to. He did all the work, or most of the work, in public health, dividing the big room, the old public health, excuse me, for Board of Elections. He's built the new security station for court security in the courthouse. And, you know, either one of those, you walk through, you can see some of the detail of the work that he did. So we're really hoping that we can get a really good individual to fill that position.
In this position also, I would just comment that buildings and grounds staff have transitioned, like public health, like many other departments, to meet a tremendous need this year. We have staff in and around the buildings all day, every day, wiping down surfaces and making sure we can keep the courts area and all of our facilities. While they're open to the public by appointment, there still is the interaction of county staff out into the public and back. So this group has really played a pivotal role in keeping surfaces clean and keeping employees safe. So certainly when we talk about, you know, what would you do if this position wasn't filled, this is an area where I think they are probably short as it is. So I think it's important to find, as Dale suggested, an individual with the skill set that we've lost, which is tremendous, but hopefully somebody who also can fit into the plans going forward. Any questions on that one for Dale? Okay, thank you, Dale.
Thank you.
And the only other vacancy on this meeting is for the district attorney. I believe that Gary is with us as well. Good evening, Gary.
Good evening.
You can go ahead and present the chief position to us.
Thank you. As everyone I'm sure has seen, we had a resignation. My former chief assistant district attorney has moved on to another position. And I think what you could see from today's announcement, I have made a decision to promote an assistant district attorney from within the office. Obviously, this position is vital to the office. It is a leadership position in the office, helps with the supervision of the other attorneys. And I think the decision to promote Attorney Charpentier, who is from St. Lawrence County, knows the area well, came back here to work specifically in the district attorney's office, will do a great job for us. So internally, I promoted her already because structurally we have to have someone in that position, obviously with the hope that we will get the approval to make it official at the next board meeting.
Questions for Gary?
Oh, sorry, Kevin.
So Gary, with the promotion, you'll be looking to fill a different attorney's position in the future?
Yes, at the next vacancy committee, we'll be putting forth a request to fill a junior level attorney at a starting base salary to fill this position being moved up.
And will that will make you full staffed?
Yes, once we fill that position, which hopefully will be approved at the March full board meeting, then yes, we will be back to full staff.
Okay, thank you, Gary.
No problem.
Any other questions? Okay, that concludes vacancy for operations.
Okay. We'll move on to committee reports. Okay. So Agriculture and Farmland Protection Board, Mr. Denisha.
I have nothing new to report since the Operations Committee report on December 14th, other than the next meeting will be held Thursday, February 4th.
Thank you, sir. Alternatives to Incarceration Board, Mr. Burke.
Nothing to report on. There's been no meetings as of late.
Okay. Board of Trustee for the Supreme Court Library. There's nobody assigned to that.
Bill.
Oh, Bill. Maybe.
Not me.
No, I think Huckle was named and that was just, yeah.
Okay, so we'll appoint somebody. Emergency Services Advisory Board, that's mine, and we've not had an additional meeting since the last time that I reported. Environmental Management Council, Nicole Terminal.
Thank you, Madam Chair. In December, the Environmental Management Committee typically does not meet, but in lieu of not meeting, one of the subcommittees of the committee, the Environment and Economy Subcommittee, decided to have a meeting instead, just to refocus, revisit their mission statement and look at their priorities. In the past year, the chair of that committee felt that their focus was more on the environment and wanted to know how we could ramp up efforts in the area of the economy. So we were actually joined by Patrick Kelly from the IDA, as well as Brooke Rouse from the Chamber, just as almost a brainstorming session to look at the workforce that we have in the county, and just to kind of brainstorm ways that maybe the EMC could work alongside the economic boosts in the area to have some economy and environment collaboration. So there'll be some next steps hopefully coming out of that. I definitely would say a great takeaway from the meeting was the fact that individuals could bring the things that they excel in or the things that they're interested in across committees, whether it be, Brooke was able to hear some people that sit on the EMC that have certain expertise or passions that they could lend to maybe other projects she's working on. So I do think that it was just a good way to survey our committee members to see where their areas of expertise and interests are. So that's that. Our next meeting is January 20th at 6 o'clock via Zoom.
Thank you.
Thank you.
Fire Advisory Board, Mr. Denisha.
Thank you. The Fire Advisory Board, we last met on Thursday, December 17th. And just some figures that I want to share. The report calls for the month of December and for the year. EMS dispatch calls, there were 1,535 calls that were dispatched in December. The total for 2020 was 18,083. Sheriff's calls for service in December, 1,195. Year total for 2020, 12,731. The total calls that were dispatched through the emergency services and part of the fire advisory for the month of December, 4,167. And total for the year, 54,850. And our next meeting is Thursday, February 18th.
Thank you, Mr. Denisha. Inter-County Legislative Committee is mine. We've not had a meeting since November. There's supposed to be something. I'm waiting for a notification in January. The Jury Board, Mr. Sheridan.
Jury Board has not met, Mr. Chairman.
Planning Board, Mr. Fay.
Basically, we will have our next meeting Thursday, January 14th at 7 o'clock on Zoom. And I think most of our topics that were covered by our county planner earlier in the meeting. Thank you.
Thank you, Mr. Fay. So now we'll move on to the County Administrator's report.
And I will combine that with my report on services.
Okay. So that brings us on to old and new business. Is there any old business? Seeing none, new business. Seeing none.
We'll do executive session combined with services as well.
So can I have a motion to adjourn?
So moved.
Mr. Forsythe, Mr. Reagan, thank you.
And if you'll give us just a few minutes, we're going to walk down between meetings.
Deep breath. I'll give you this to go on the other thing.
So there are no appointments on the services, but there are quite a few for that. Okay. Yeah. Yeah. That would be great. Okay, thank you.
Thank you so very much. I will agree with that. When I get in the car. Perfect. Thank you. I have to go home and have a dog with a problem. Well, the old one, and she needs meds. Yeah, but that, well, no, we get them at the pharmacy, but it's just somebody has to give it.
What do you do? All right, good job.
Thank you.
Some John had it bad.
call to order the Monday, January 11th services meeting. I'd entertain a motion to approve the minutes of the December 14th meeting by Mr. Denisha, seconded by Mr. Reagan. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. The first resolution is from Community Services, authorizing the chair to sign the Stop DWI 2021 plan for the New York State Governor's Traffic Safety Committee, and I move for its adoption. Seconded by?
Approval of the minutes. The approval of the minutes. The first.
I think we did do the minutes, I don't think we did the agenda.
Didn't do the agenda. I'll back up. I would need a motion to approve the agenda by Mr. Forsythe, seconded by Mr. Reagan. Discussion? Seeing none, all in favor?
Aye.
Any opposed? Carried. We've already approved the minutes. We'll go to Jay Ulrich for the first resolution that I just read. And is there a second to that resolution? By Mr. Perkins. Mr. Ulrich. You're on mute, Jay.
I'm sorry. Thank you and good evening. This first resolution is one of our annual resolutions, asking the board to authorize the chair to sign the 2021 Stop DWI plan that's submitted to the Governor's Traffic Safety Committee per the approval of the county attorney.
Are there any questions? Seeing none, all in favor?
Aye.
Opposed? Carried. The second resolution is accepting a donation from Seaway Valley Prevention Council for the Community Services Chemical Dependency Clinic. And I move that for adoption. Is there a second? By Mr. Forsythe. Jay?
Yes, about a month ago, I was contacted by Larry Calkins, who is the executive director of the Valley Prevention Council, which is a certified OASIS prevention program. And they had 2 laptops that they no longer had a use for, and asked if the county Community Services Department could use the laptops. So we did secure the laptops. We took them down to the IT department. We looked over the laptops and approved them for use, county use. They're still under warranty. They're a little larger footprint than the ones we typically use, but we can certainly put them to good use. Have one peer that certainly benefit from being able to do her notes while in the field, rather than trying to punch it out on a little tablet. So I'm asking to accept the 2 laptops. There is a caveat within OASIS programming that an OASIS program can donate, things that they are no longer have a need for or have a use for, as long as they donate it to another existing certified OASIS.
Okay. Thank you. Any questions? Seeing none, all in favor?
Aye.
Opposed? Carried. Jay, you want to provide a update to the activities in the clinic?
Okay. These updates are for December. If you look at the no-show rates, they did go up in December. For the mental health programs, they went up 2.5%. And overall, they went up about 1.5%. Some of that could probably be attributed to the holidays. But as we go through the update, still moving the needle upward in terms of our production. So I attribute, even though we did have a higher no-show rate, I attribute that to the diligence and the efficacy of our staff to be able to reschedule and backfill scheduled appointments as needed on a daily basis.
Thank you. Any questions? I'm sorry, go ahead, Jake.
I mean, just a brief overview. I mean, we've really gone up in all areas. I think the most salient point would be that the chemical dependency, in terms of their weighted visits, in November, we're at 59.5% of their time spent in the office was face-to-face billable hours. That jumped to 70.6%. There was a resignation. So instead of there being 8 chemical dependency counselors, there's now 7. So we redistributed that caseload, which allowed them to have more full. The schedules were more full, allowing them to increase their productivity. So they're at 70.6. You know, the goal that we've set, the bar that we've set is 72, but they're moving towards that expectation. With mental health, they continue to meet the expectation. The average face-to-face billable hours was 77.5. Again, we expect 72%. There was a little decline in prescriber visits. The average was about 10 visits a day. November, it was 10.9. It's difficult for the prescribers to sometimes reschedule their appointments because they're on a rotation. A lot of them are seen every 30 days, so it makes it sometimes difficult to reschedule, backfill those appointments. With regard to waiting list, I have an update. Chemical dependency or the addictions clinics now have a wait list of 13. And this week, the mental health wait list is now at 40. With an additional 8 individuals that are just getting medication only, meaning they are on psychotropic medications, but they are not receiving counseling services. That number is really 48. We have started advertising for a mental health counselor, both in the county website, North Country Now, and we also put it on Indeed. Thus far, we haven't had a lot of response to that, though. In terms of services provided, individuals served, with the exception of August, we continue to have a slight increase in the number of folks in the community that we are serving. And then for July, we did have a reimbursement rate of 89.65%. The goal is 90. Certainly, we'd like to surpass that, but if we could get to 90 consistently, that's what we'd like to observe.
Thank you, Jay. Any questions? Mr. Burke.
Well, Jay, it's great progress, and I appreciate your work, your leadership, and the work of all your staff. I guess I just wonder, what are your big challenges right now, Jay? This COVID couldn't have been easy for you to deliver services, so I just wonder what your challenges are.
Well, I mean, the clinic challenges, continue to remain, working at 50% in the office, 50% at home. There are some staff who are using their benefit time, choosing to use their benefit time because they don't wish to spend their 50% of their time, in the office because of COVID. So that's a slight challenge. It really impacts about 2 staff members. I just think in general, from my perspective, yes, there is the day-to-day running of the clinic, but, all the expectations, the reporting requirements, the portals that they're now rolling out because of the vaccinations and tracking that, certainly that's time consuming. I have delegated some of that responsibility to the mental health coordinator, services coordinator for the county. But, it's just, every day is kind of a new day in terms of the guidance that, we're expected to go by, and it's updated very frequently, and it takes, a lot of diligence to go through those on a regular basis and make sure you're meeting the standard and the guidance that are rolled out by the regulatory agencies.
Thank you, Jay.
Ms. Haggard?
Thank you, Mr. Chairman. Jay, I think we have learned that COVID has caused an uptick in mental health needs. And when you say we have 40 people on a waiting list, how long does it take if you're number 40 to get help?
Well, we triage that list. So,
okay.
It's not like, they're just applying for services and we don't know anything about these individuals. The program coordinator or director for the mental health program, is vetting that list, prioritizing that list. And if there is some acute need, we are getting them in on a timely basis.
And is there anything we can do as a board or to help with, I don't know much about this, but that seems like a long waiting list, is it? Or has it been worse before?
Well, it certainly has been worse before. I mean, there's been times in my career that it's been over 100, well over 100. And some of those people, you would call on a monthly basis as a check-in to see where they're at and if they were still in service. If they found services elsewhere, you take them off the list. So, yeah, I mean, has it been worse? It certainly has. But we'd like to, have a smaller waiting list. But at the same point, you want to make sure you have enough individuals for an onboarded counselor to come in and be able to provide food, and stay busy and productive in that role.
Thank you for clarifying that. Thank you, Mr. Chairman.
Is there anyone else? Seeing none, Jay, thank you very much.
Thank you.
I'll be in contact with you sometime this week if that is available, or if you have some time available. Do you know when you will be in the office?
Well, I have a personal responsibility to my family this week, and I'll be heading down to Pennsylvania after the last demonstration from the electronic health record on Wednesday. So I plan on departing around 2 o'clock on Wednesday. But I will certainly have my cell phone with me, and I believe you have that number. If not, I can get that to you.
I do, and I may even wait for the following week, Jay. So anything further that you want to add?
I don't believe so. Thank you.
Mr. Akers has a question, I believe.
Just to answer Margaret's, I think, related to the COVID, because you go back to in August, we had 0 waiting list in any of those categories. So I think we had 25 in October. So it's definitely COVID related. Because previous to that, we didn't have any waiting list at all. Thank you.
Okay. Thank you, Mr. Akers. Anybody else?
Thank you, Mr. Akers.
Okay. Thank you, Jay. Have a great trip.
Thank you. Yeah,
you're welcome.
Thank you.
All right. The next resolution is modifying the 2020 budget for the Public Health Department for the Health Research Incorporated HRI COVID-19 grant. Moved by Mr. Denisha, seconded by Mr. Perkins. The county administrator will take over on this for Dana McGuire.
She actually is able to join us.
Well, Dana, I'm sorry I didn't see you up
That's
there.
okay, we weren't sure.
All right.
Hi, everyone. This is just a resolution to modify the budget for the expenses that we've had so far in the COVID response.
Any discussion or any questions? Seeing none, all in favor? Aye. Opposed? Carried. The second resolution is a resolution modifying the 2020 budget for the Public Health Department for the Epidemiology and Laboratory Capacity ELC COVID-19 grant. Moved by Mr. Forsythe, seconded by Mr. Perkins. Go ahead, Dan.
So this resolution is also to modify the budget for the work we've done on the response. These two grants are what we've received as the federal funds through the emergency preparedness program that we have. This last one that you mentioned pays for case investigation and contact tracing, where the first one that we just that I just mentioned does for the work that we do, plus all of the supplies that we need in our office and those that we need to purchase for those in the quarantine and isolation process.
Are there any questions or discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Dana, is there anything else at this time?
Nope, that would be all my resolutions.
All right, thank you very much. The next item is the vacancy review with the county administrator, please.
So for the balance of the vacancies considered this month, we have 5 and then just a discussion point under social services. The first one up is community services with Jay.
Jay? You have the floor.
Thank you. So this first vacancy authorization is for an account clerk. We had an account clerk that's been with the department for a little less than 4 years, who was our most tenured staff in that department. And she is transferring to another department within the county, so it opened it up. There was some discussion at vacancy as to whether it might be good to fill this with a senior account clerk, to bring someone in that may have some some experience and expertise. But account clerk's kind of a wide title. So just because it might be a senior account clerk doesn't necessarily mean that they would have specific experience in medical billing. That, along with the fact that we're going to be bringing on a new electronic health record, which is kind of a very leveling or a ground zero type of effect, that we're all going to be learning this together, it was decided that we would continue with the account clerk rather than the senior account clerk. So we're asking for an immediate fill for this position.
Any questions? Seeing none, Jay, thank you.
So the second vacancy authorization is for a fiscal manager for the COSUP grant, which is the opioid treatment program grant that has wraparound recovery housing services as well as community-based peer service. There was some discussion about how to best manage the grant and where this person should be embedded into, and it was decided it would be best that they worked closely with the LGU, that being the Community Services Board, and myself, as we move forward to implement this grant, rather than be embedded in one of the sub-awardees programs or organizations. So this is a resolution for the county to hire a fiscal manager to oversee this 3-year grant process, to ensure that the reporting is done accurately, that the vouchers are submitted in a timely manner, that the agencies are moving forward according to the timeline set forth within the grant application. So I'm asking that the Community Services Department be able to hire this particular position to oversee and coordinate the grant for the 3-year period.
Any questions?
I would just, if I could speak to that. A lot of discussions about the advantages and the challenges associated with having someone represent the county, because if you recall, this is still the county's grant. So I think when we tried to look at the first award of this size, and ensuring that the priorities of setting up this grant and tracking and reporting and being able to maintain the reputation the county has thus far was critical. And also being able to look at the opioid grant that you'll all remember we're about 1.5 years into a 5-year grant. I think we also had conversations about being under-resourced in that area so that both Jay and Dana have not enough time to dedicate to that. And this being the opioid treatment program grant, we also thought that person could assist with that effort and tie the efforts of all of them together. And not only that, but when it comes to being able to establish priorities, we may not have that if we were to add this to the services provided. So the sense was this person will organize and maintain that throughout. And with the concern of this being a full-time FTE, we can backfill that with work that both department heads have not been able to dedicate the time necessary to. And it will be at no cost, benefits or salary to the county.
And Ms. Terminelli.
Thank you, Mr. Chair. I have just a question about the zero cost to the county. Is that because of the position as part of the OTP, or is that because it's funded through the administrative component of the grant?
The latter.
Okay, so after the 3 years of the grant, would this position then become part of the county's cost, or will it continue to be funded by some other outlet?
Our hope was to include language as we discussed at vacancy that when the funding goes away, the position goes away.
Okay, thank you.
Are there any other?
Anything else on that? I didn't want to come in.
I'm sorry. Anyone else? Seeing that, I have a question. With respect to grants, how do they go through our hierarchy here in the county once it's decided that we're going to apply for a grant? What happens with that when, say, one of the department heads says, there's a grant out there, I'd like to apply for it? How does that process work?
So with regard to the application of a grant, we don't require that departments come through the formal committee and board process because there is a chance they won't be awarded. I think that the conversation happens at the department level. In some circumstances, it happens with the budget team. And in some circumstances, it happens as a direct communication between myself and the department head or their fiscal staff. But once they have received the grant, it comes to the board for explanation, processing, and all that approval. Because if the board were to decide it's not something that the board's interested in doing, it could be turned back, which was discussed on a number of occasions. And then once that happens, we move through the normal contract transmittal. Typically, if a position includes, or if a grant includes a position, we have that conversation at the onset.
Prior to the submission of the application? Okay, thank you. Anybody else? Beg pardon?
Sorry, one more follow-up.
I'm sorry, go ahead.
No, it's okay. What you said just made me wonder this. So on the our vacancy authorization form, it says that the position is permanent. If it's indeed, and if it ends at the end of the terms of the grant, is it permanent or does it have an end date for the position?
So, and Johnny's here as well, she could add to this. The permanent nature of this is for civil service purposes. So the person could be appointed to it. And let's say that after 3 years, that position went away. They would, if they've received permanent appointment, which if they haven't taken the exam, they have to go through that process and meet the criteria for probation and then be permanently appointed. If that position went away, when the grant funding went away, they would be on a list to be called to the next fiscal manager position that became available.
Anyone else? Seeing none, thank you very much, Dana McGuire. To the next, or I should say, Jay. Next to Dana McGuire.
And Dana may have left. The webinar she was scheduled to attend was having some difficulty. It's up and running now.
Okay,
So I can present on these positions.
please go ahead.
The first position is a public health specialist. The board has been generous and granted me authority to create temporary positions, and we have done so in public health with 2 of these titles. That has given Dana an opportunity, much as we discuss in a few other departments, an opportunity to preview employees, if you will, to see if they're a fit for the department in a temporary status. Now, this has filled 2 goals for us because it's helped with the horsepower necessary in public health, but it also has given an opportunity to identify the need for a permanent position. So what is being requested here is to maintain those temporary positions, which we look at while COVID continues, but also to add a public health specialist, which they have identified an individual who would be a good fit for the department, that is already trained and ready to start in a permanent role.
Any questions or discussion on this position? Seeing none, moving
Okay.
along.
The next one is abolish a registered nurse position and create and fill a public health nurse. And you'll recall, certainly carried mostly by Dana, but a conversation over the last few years about converting nurse positions, not with an interest in displacing anyone that's currently employed, but when people either retire or the position becomes vacant, to take a look at those to make sure that they should still be a public health or a registered nurse, or in this situation, after recruiting for a period of time and not being able to fill, looking at the public health nurse position. That is a higher grade, I believe by 2. Don't hold me to that, I can certainly verify that. But that would allow more of the positions to move from being registered nurses over to the public health nurse. And that provides more latitude for the type of work. So as you understand, in conversations with Dana, over the years, the clinical nursing component isn't as heavy in public health. It is a lot of administration of programs, a lot of reporting and collecting data. So that public health nurse position would fill their need.
Mr. Akers.
In our contract negotiations, this was a spot that we tried to correct and we were unable to do so. Does this accomplish what we needed to accomplish so that we could be competitive in hiring nurses?
It accomplishes a salary component, but also from a workload perspective, it provides more latitude for the department as well.
Thank you.
Anyone else?
Next and last is for public health is a community health nurse position, which we had at the end of 2020, a retirement. This position, I believe, works in immunization program, which certainly is valuable at this time, if not all others. But the position is sought to be filled at the same level, community health nurse.
Any questions or comments?
And I would just also add that community health nurse is above the public health nurse. So I know sometimes these titles all seem interchangeable, but that's a higher level nurse as well with more experience. Any questions?
I don't see any. I have a question for you.
Okay.
As far as the vaccinations,
Yes.
does public health have, or have they generated enough response and got enough volunteers or staff to provide these inoculations once the vaccination comes in?
I would say at this point, not yet, but that's balanced by not knowing how much we'll be getting. So I can speak to that under my county administrator's report, if that's okay.
So we have not been advised how many vaccinations we will receive?
Correct. Or when.
Or when? Thank you.
Okay.
Moving
And
on to the
last
county
one.
events.
No, we got social
Oh,
services.
I'm sorry.
Yep, just one. There and then a note.
Cynthia Ackerman? Or-
Yes, should be here.
Welcome.
Good evening, everyone. So the position that I'll be.
Go ahead.
It's all yours.
The position that I'll be talking about tonight is for a director of services. We are going to do an abolish and create. This will be a new position. We're basically replacing the deputy commissioner with the position for the director of services. This will be a permanent position, full-time, at $29,418 cost for the county. With this position, we're going to be seeking a candidate with an increased specialization, specialized knowledge in child welfare, which differs from the deputy commissioner. This person will be specific for adult oversight of children's services, adult protective services, child protective services, and adoption. So with that, and I think I've spoken before on the Family First Preventative Act, and this person will be moving, kind of taking that initiative, moving forward with that, providing all the oversight for that. So we really thought that when looking at the position of Deputy Commissioner versus Director of Services, that for the department at this time, that this position really was a better fit.
Any questions or comments? I'm sorry, I thought you were finished.
No, I was, but I was just going to say that this person, this position also, though, will be in the commissioner's designee in their absence.
Any questions or comments? Mr. Akers.
So is this a similar salary as to what the assistant commissioner would be? So less money, more money, the same? What do you got?
This will be a grade M5. When we had discussed the position of deputy, we were considering moving that to an M6. So this will remain as it was initially as an M5.
So I don't know the difference. So is that the same, or do you know, Ruth?
They overlap between the base and the max, but band 5, I can get you the differences.
I'm just asking.
When they start, yeah, they overlap at the top of 5 and the bottom of 6, but 5 is lower.
So does this title, they don't know if the assistant director had additional perks or anything of that because of the title versus this. Is there any job delineation other than, this is quite specific, which I think is a good idea. But it's a salary position. Is there additional duties that are being required or less than what your assistant would have that you've chosen not to hire?
Yeah, it'll be less than, because they won't have the responsibility over the eligibility side of Department of Social Services. It will be just specific to the services side, where the deputy commissioner would have had, semi responsibilities over everything in the department.
Okay, that answers my question. Thank you.
Okay, Mr. Burke.
Question, it's not specific for Cindy, but it is in regards to vacancies. I guess I wonder, and it goes back to Jay's account clerks and the nurses in public health. Are we monitoring turnover rates, and are we doing anything in particular to create eligibility lists so that when critical positions are vacated, that we have a list of people ready to fill them?
I would say yes to that, but that's I think an oversimplified answer. Johnny, are you there?
I am here.
Can you speak to the turnover that we've been talking about?
Yes. Specific to what positions again?
You mentioned the account clerks, the nurses, things of that nature.
Well, nurses, child protection workers. I mean, there's a whole list of people that we have. I believe we would probably define them as critical positions that when they become vacant, they need to be filled quickly. Or at least I hope we have that kind of a listing that we know what items are critical and which ones we should have lined up for filling. Do we have that, Johnny?
So we do an exam plan every single year. And so we do is we look at what exams, what lists are very low on the number of candidates that are still on the list. We go through the I can't remember how many there are, 100 lists. We go through all of them. We look at how many of the lists have low numbers on them. We put that in a plan to order an exam. And then we also look at any of the critical ones where we see a lot of turnover or where we know that there's issues. So for like caseworkers, with COVID, a lot of the tests have been canceled, and New York State doesn't want us to hold them, because what will happen is if we hold our exams, then an employee, a candidate could go to another county and take the same exam right after they take the exam for us and have an advantage over all the other people in that test, because it's the same exact test. So when we take our test, New York State schedules these so that we in other counties in New York State are all holding the test at the same time. So for COVID, we actually went ahead with our caseworkers, and we went ahead and held those tests. They're decentralized, so we can hold them at our own level and score them at our own level. And we actually continued to hold that for caseworkers especially. So we did that twice a year. And that was the only test we actually held during the beginning of COVID, right near the middle of COVID. But we do a plan every single year. We've just, I actually have a write-up of the plan and what we are looking at for lists, for exams, for ordering. We have many of these lists have many people on them. I just got asked today about the clerk list. There are many, more than 40 or 50 names on our clerk list. There's account clerk list. There's many names on that, or there's still names on that. So we do watch that very closely. And we do a plan every single year. And even during the year, we know which ones are getting low on the list as we send out lists. So we do order them at that time too.
So I would just add to that also, John, that, when we looked at the annual turnover this last year, I'm certain that it was COVID related in part, but we were down by about 32 positions, I think, from the year prior, or our 5-year average. Typically, we're seeing about 160 to 165 positions turnover in a year's time, but this past year was about 130. So I think in part, we're seeing a little bit less of that. I think the board's been very gracious in certain requests that I think have happened at vacancy, as well as on the board floor, about overlapping positions before people leave in some circumstances where knowledge transfer is critical. And I think also, looking at our civil service process playing out, the example, and we'll talk about this a little bit more in a minute, but when we've got multiple positions in the same title vacant, it's also an opportunity to take that same interview pool and be able to pull in more than one to fill that title. So that's, one of the efforts that's underway. I think we can always improve. I think looking at, that percentage associated with our exit interviews and things of that nature, they can all support strategies for how we decrease the turnover. But I think some of these situations is a salary issue. Sometimes it's leave for a less stressful position, things of that nature. We are seeing a slight uptick in the transfer between departments, which I'm happy to see. And we could put some statistics to that as well. But I'd say in the last couple of months, we've seen the majority of those be transfers to other departments. So I think that's modestly encouraging as well.
Well,
go ahead.
If I could have a follow-up, and that would be retaining people. Now, Jay talked about an account clerk that went to another department within the county, and maybe at this particular point in time, that's not critical, but when he gets a new system in there, when he gets a new billing system, with the training that's invested in that, I mean, are we taking a look at how can we keep people that require a fair amount of training? How can we keep them in the department? Versus, and again, I'm all in favor of people having the ability to be promoted, but perhaps we should be looking at promoting them right there, because the cost of replacement, the time for training, and it's kind of like the child protective workers that we've heard. It takes the better part of a year to get them up to speed. And I'm glad to see that you did that with the nurses, that you looked for a similar title so that we could recruit registered nurses. But I guess I'm wondering, is there a strategy that we can take a look beyond recruitment and look more at retention in positions that require an intense amount of time to train people?
Happy to, and we have a few ideas we're working on, John, that you'll be hearing about in the next couple of months. That we hope, that tilts more toward the retention is what I hear you talking about.
Yeah, it is.
Yep, and we'll be bringing you some things to consider on that shortly.
Thank you.
You bet.
Mr. Forsythe? I'm all set. All set? Anyone else? Mr. Akers?
Just a comment, and I agree with where John's coming from, but I think every employer is trying to figure out, no matter what occupation they're in, is how to keep employees and keep them around after, because everyone, whether it's on the farm, up in Cal, something is similar or as simple as that is about retention. And money helps, but it's not everything, and the benefits help and the work environment. But I think particularly there's no way of knowing that when we hire individuals, particularly caseworkers, where they see the worst of humanity, about how they're going to react. We just lost a woman, 59 years of age, that had been with us for 35 years. How did she ever do it? When we were interviewing for the probation director, many of those individuals that we interviewed had caseworker experience, and many of them had less than 2 years. And when I asked them about it, they would get this faraway look, like they said they couldn't sleep at night, and they just couldn't handle it anymore. So you never really know. These are really high stress positions, John, and I think if you can write the book, I'll buy it, but I understand exactly where you're coming from, because turnover is expensive.
Mm-hmm. Thank you.
Anyone else? We'll move on to the county administrator report.
Yes, and just one other item, I think Cindy's still there with us. We just wanted to mention, certainly relative to this conversation, but the 4 vacancies that currently exist, one was just filled in social services relative to prevent, so that's the caseworkers, either for CPS or for the prevent side. And right now, it was looking like there were 2 in CPS available for fill, and 3 all approved, ready to move forward, and 3 on the prevent side. Identifying that the last couple of months have been particularly challenging. You'll remember not that long ago, where we had really gotten very close to having all of the caseworkers in or close to the total that the state requires or suggests for CPS open cases. So that has changed, and so the interest that the department has is to potentially look at filling on heavier on the CPS side. And this is a situation where, while there are different position numbers, where the need arises, rather than wait 4 weeks before another vacancy occurs, my suggestion to Cynthia was I would bring to you that we'll fill where the need exists, and that duties can be assigned by the commissioner. And then we can make the adjustment of the position numbers, so in fact, we fill where the need exists. Currently, the prevent side is okay. I won't say great, but it's doing okay. I think the greater need exists on the CPS side. So what I wanted to make sure there's no objection to is if we move in that direction, and then we can add on our board meeting the changes in the position, as you recall with the social workers and the mental health counselors, right? So we allow them to fill whatever they can hire. In this case, CPS is in greater need. We make the paperwork adjustment when the board meeting comes. Is there any real questions on that or concerns about trying to meet the need that way rather than waiting another essentially 8 weeks once the civil service process plays out? And we'll see how it goes. Cindy, did you want to add to that anything, or does that sound okay?
No, I think that sounds perfect. And I did have a discussion with my staff about that. So I think it would be extremely beneficial to the department at this time.
Any questions about that? Okay. So then moving on, thank you, Cindy.
Thank you.
So then moving on, for the county administrator's report, the COVID-19 update, as you've heard in a couple of different scenarios, the vaccines have not yet been provided to the county. for distribution, and as soon as those are, our goal is to be prepared to roll those out. Certainly the priority groups help us establish that, but right now we're focusing on education and awareness. Certainly a lot of the information being pushed out by the state is aimed at that, and the 3 basic pillars associated with equitability, availability, and safe. So those will continue to push and put some press out about that to make sure we can educate the public when their time comes for availability of the vaccine. The sites that were identified in conversations are proximate to, but not on site at the hospitals, and that really was intentional. We certainly, as you heard from Dr. Williams, don't expect great adverse events associated with the vaccine administration, but we do, as the hospitals continue providing vaccines to their population, we wanted to be very close to them if that need arises. We continue working with St. Lawrence Health Systems, Clifton Fine, and Claxton Hepburn on a daily basis at this point, but we don't yet, as I mentioned to Chair Lightfoot, have a number that we should be expecting or the arrival date. So we're trying to prepare so that when it does arrive, we can move forward. The county will hold community pods, partnered with them, and also, as I mentioned to you previously, we'll try our best to provide our employees and run a pod at our county jail site. So that would provide the opportunity for folks that we may reassign to work at the community pods, the opportunity to be vaccinated before they are in those environments. Pharmacies are involved with the senior population as well. But I did just want to take a minute. We've transitioned quickly from the testing and the evaluation to the vaccination. And the transition that the teams at all of the hospitals I just mentioned has been tremendous. And our county staff as well for transitioning into this process, this strategy, and these concepts so that we are ready when vaccines are here. We're pulling our teams together with the information that we have, and we have one shared goal, and that is to vaccinate as many people in St. Lawrence County that are willing as possible. And I think Dr. Williams also mentioned the North Country was reported on Friday by the governor as the highest percentage of 1A populations vaccinated in the state at 37%. So we're very proud of that as well. But I do want to share, as we continue seeing cases pop up in the county, we did have another case in social services. So they will close the facility tomorrow to be cleaned again and reopen on the 12th or on the 13th on Wednesday. So that we did evaluate the locations and assembled the contact list, and that will require that we have Robles come back in and do a cleaning for us. There were 2 cases among solid waste staff in Messina and Ogdensburg transfer stations. So the cleaning has already occurred in Messina, and we'll be scheduling that for Ogdensburg as well. Running right now, and why Dana had to step off the call, is an informational webinar hosted by Department of Health and the Governor's Vaccination Task Force. We hope that that continues the information flow and gets us better prepared for vaccination rollout, as we don't feel as though the information we have or that we can convey to the public is sufficient yet. Also, last Friday, we did have a phone call with Rheonics. They're preparing for the next couple of weeks, so I believe it's the week of the 18th. Their intentions are to deliver to Claxton Hepburn Medical Center first, and they'll follow up that next week with training on the device and get that up and running. We expect to hear this week when St. Lawrence Health Systems will be receiving their device as well. The work will begin on the 19th for the broadband survey with the vendor Dank has hired. I have asked our planning director, Jason Fotenhauer, as well as Rick Johnson in IT, to work directly with the vendor to prepare the information needed and throughout the process of that project. Also, the statistics for social services are uploaded to Google Drive for your review. And just a reminder that there's no meeting next week. Our county offices, aside from our 24/7, 365, will be closed for Martin Luther King Jr. holiday in his honor. And also, lastly, the Workforce Development Board will meet for the first time this Wednesday, this first time of this year. Any questions?
Mr. Akers.
Ruth, as far as the payment for the Rheonics machine, was a down payment required, or we paid for them in full?
I can find that out. I know a purchase order was cut for them to be made, but I can find out for you.
Okay.
That was in order to get the orders pushed through.
Anyone else? Seeing none, we'll move on to committee reports. The Department of Health, Mr. Akers.
I believe we're meeting on the 19th.
There is no report from the CDP Board of Directors. Community Services Board, Ms. Curran? Doesn't appear that she is available.
There.
Office of the Aging Advisory Board, Mr. Denisha.
Thank you, Mr. Chairman.
You're welcome.
I don't have anything to report since the last services meeting in December. Our next meeting is next month, February the 8th.
Thank you.
But one thing I do want to, I always like the opportunity to report on Office of the Aging, because it gives me a chance to put in a lot. And everyone has probably seen this, but it was released in the newspaper, and it's as critical today as it was when it was released back in the middle of December. Due to the COVID pandemic and the severe impact on older adults, Office for the Aging has record numbers of new clients seeking services and support. Office is in critical need of volunteers to assist at 6 nutrition centers: Fraser Falls, Canton, Cal, Governor, Morristown, Ogdensburg, Potsdam, Star Lake. Volunteer opportunities include delivering hot meals to homebound seniors or helping staff with meal preps at the nutrition centers. If anybody is interested, if you got an hour a day, if you got a couple hours a week, if you got anything, please call Danielle Duran at 386-4730. And I guarantee you she will find a spot for you to work. Thank you.
And that is not exclusively for the members of this board. That is for the information of the general public that may be watching this.
Absolutely.
And the phone number is 386-4730 for anybody that's interested.
Yeah, and I know this was a press release that was released to the newspapers last month, but the need is still there. It's as great as it was, perhaps even greater.
Okay, thank you. We'll go back to Ms. Curran, Community Services Board.
I listened in on Community Services last week, and they talked a lot about mostly the new EMRs that they're looking at and how that's going to go. The first session of listening to all 3 hours of it was kind of a learning curve, but truthfully, they go right through each section of it kind of in order. And Kevin, you're right, they don't really say anything. They say stuff, but there's no chit chat back and forth. It's kind of basically, there's a lot going on over there. Much of what they're working on is how to respond to the COVID situation. People that are either not willing to come out for services, are not willing to interact with people for services. And they had a lengthy discussion about the psychiatric nurse practitioner for children. They had one of them, and that person moved away, and they're now looking for replacement people and contracting to try to figure out how to serve the area, because we didn't have one anymore for the St. Lawrence Psychiatric Center is down one, so they moved one to another program, and they're recruiting. And that's kind of it. They talked about our waiting list. Any questions? There's a lot. I have pages of notes on it. Just how it's all organized is quite a bit.
Any questions for Ms. Curran? Thank you very much.
And sorry, I didn't hear you earlier.
Youth Advisory Board, Ms. Terminale.
Thank you, Mr. Chair. I had reported out on our December meeting at the December Services and Ops meeting, but since that time, and our next Youth Advisory Board meeting is January 27th at 3 p.m. But since that time, we have had our Youth Committee meeting. So now that Youth Advisory Board actually is made up of 2 smaller committees, so we have two meetings a month. we had our meeting on December 16th, and we had a presentation from Caitlin Potter from SNAP and Casey Caswell from SNAP Ed about some of the programming that they're able to do to encourage eating healthy when on a budget, educating community, making healthy options accessible, and some policy and systems, environmental change information that they would be happy to roll out to any of our youth organizations. They are planning some virtual workshops. There was one, I believe, held on January 7th for vision boards for the youth, but they also have a healthy snacks one coming up in February, I believe around the Valentine's Day, just how to have some healthy fruit snacks, sweet. The youth committee that serves the youth population is currently doing a membership drive. So if anybody knows of any youth members that would like to be involved in the youth committee portion of the youth advisory board, we are looking for applicants. And we're hoping we've got one of our youth committee members has some great ideas for collaboration with the Environmental Management Council. So we're hoping to get him on the agenda at our next meeting just to see if there's, again, a partnership that could exist between those two committees. And that's all I have. Our next meeting for that is on January 27th.
Thank you very much. If I might be so bold, you are a member of the Ogdensburg Bridge and Port Authority. Is there anything going on over there that would be of interest to the county, or something that perhaps we could look at in a joint way with the Bridge and Port Authority?
I would be happy to mention that at our next board meeting and see if there's even follow up on that with you. Right now, we just currently ended our negotiations, or were able to sign the contract with the Ogdensburg Police Department for security for next year for the airport, so that we can continue to see that. We're hoping to hear back on our EAS proposal. So that's news we're anticipating. The possibility of possibly having a low fare carrier in addition to our hopeful. And then in the mid-year of 2021, pushing into the expansion of the port. Those funds have been earmarked, and so we'll be starting that construction hopefully mid-year. But for sure, would love to have collaborative efforts on that. We have some building space that's available. It'd be great to partner with the workforce development to see if there's a way that we could support the people that we currently have leasing spaces, or the businesses that are in our Commerce Park. So definitely, I'd be interested in seeing ways that we can work together to work smarter and not harder to benefit all of the people of our county.
Well, thank you very much, and I really believe that that everyone on this board would like to see a collaborative effort with the Bridge and Port Authority for things that would mutually benefit both boards, and particularly benefit the greater Ogdensburg economic area. You're going to start some dredging here, and there will be a webinar, I believe, during the first week of February on that. And I think that will prove to be interesting, and will allow for more marine commerce to come into the city and offload their products, or even unload some of them. So anything that of interest to the county, or vice versa, interest to the Bridge and Port Authority on what the county is doing, I think, and I hope would be beneficial. So if perhaps you could include that in the next time you report.
I'd be happy to, Mr. Chair. Thank you.
All right, thank you very much. Any questions of Mr. Mel? Mr. Forsythe.
Yeah, Nicole, is there any collaboration between Youth Bureau? Larry just put out a mention about Office for the Aging and volunteerism
and getting it instilled in these youths. It seems to be a dying habit. Is there any collaboration between the two?
So thank you for asking that, Mr. Forsyth. And there have been a couple of collaborations that have occurred recently, not in the realm of volunteerism per se, as much as we had the Youth Bureau ran a card drive that went along with the Office of the Aging's food drive that they did in delivering the baskets to their members over the holidays. So students across the county were involved, and I believe, Ruth, you'd probably have a number, but I know that I think it was close to 1,500 cards that were contributed on behalf of that campaign from the youth committee or the youth advisory board to put with the Office of Aging baskets. For sure, we're always looking for opportunities to get our youth involved. Our committee is small right now. The portion of the committee is small right now. And that's one of the things that we're working on. But what we're finding is a huge obstacle in this is that most of our involved youth that we have, they're involved in many, many things. So even nailing down right now, we're finding sometimes it's difficult to even nail down a meeting time that works for everybody because they're involved in academic endeavors, sports, tutoring, but definitely on our, we're working on our 2021 missions that we would like to accomplish as part of the youth committee. And for sure at our January meeting, I'm happy to see if that's something that the youth committee members are interested in canvassing and getting volunteers that could serve that purpose for the Office of the Aging.
Thank you very much.
And Alexa is on with us, so I don't know if there's anything that maybe she could speak to specifically that's developed since our last meeting.
That's the lovely part of having them out there. I'm getting texts as the conversations continue about some of the programs. Andrea's out there too, as far as Office for the Aging is concerned.
Okay, well, it's very interesting. Thank you very much.
You're welcome. Did Alexa or Andrea, did you either of you have anything that you'd like to speak to answer Mr. Forsyth's question a little more clearly?
I think we always leave the opportunity open for volunteerism. As Nicole had mentioned, sometimes attendance is a little bit concerning from our youth committee members, not due to the fact that they don't want to be involved. It's because they are so involved with other extracurricular activities and sports commitments and so forth. The holiday card drive in December was, it was huge. It was so successful. I know Andrea probably has some numbers to report. So successful. I haven't had the opportunity to talk to Andrea yet, but Ruth and I were perhaps playing with the idea of doing a Valentine's Day card drive between youth and Office for the Aging. But I know Andrea often is looking for some volunteer opportunities for Office for the Aging. So my ears are always open and we do communicate it consistently back to our youth.
So if I could just add quickly, thank you, Alexa. Yeah, with the younger, certainly the high school students, our delivery time is when they're typically in school. So that hasn't really been something other than in the summers, we often host youth through the Summer Youth Employment Program at our nutrition site. So it is something that we do in the summer. But one of the things that we're not quite ready to fully announce yet, but that is in the works, is Alexa and I have been speaking the last few weeks or so about starting a pen pal program between some of our vulnerable, isolated, lonely adults and some of our youth. Certainly letter writing in today's society amongst our younger adults isn't something that's done as frequently. People use technology. So we'd like to start a campaign where working with our local schools as well as some of the older youth as well, they would be able to start communicating with some of our older adults through a pen pal program.
Good.
And if I could, I think that number was over 2,000, wasn't it, Andrea, in the end with the card drive?
Yes, it was over 2,000 cards in the end. So we gave most of our clients at least 1 or 2 cards, as well as sent some to the local nursing home as well.
And the goal was 700, was it not?
The goal was say 700 nutrition clients. So they all received at least a few wonderful holiday cards. And the feedback from them is they absolutely loved them. They loved the pictures, stories. The kids were really creative. And some worked they worked so hard on them to make it something that would be really special. And they did a great job.
Good stuff.
Okay, well, thank you very much, and thank you for staying late with us.
No problem.
All right.
Mr. Chair, could I update for Mr. Akers' question about the Rihanna machines?
Yes, ma'am.
The money has been encumbered but not paid yet.
Thank you.
Okay. All right. Any other questions? Any old business? Any new business? Seeing none, we have need for executive session for negotiations, litigation, personnel, and appointments. Can you tell me what the personnel is?
Personnel is a matter of time, of course, for an individual.
An employment history issue. Is there a motion to go into executive session by Mr. Forsythe, seconded by Mr. Sheridan? All in favor?
Aye.
Opposed?